So, hello everybody. Thank you for joining us tonight. I really appreciate Jonathan Stokes and E.R. Mazar joining us tonight and co-leading this session. Many of you met John and his team during the conference in 2016, and John is here to give us an update about what they have learned through the information that you have shared. And we really appreciate John and E.R. for being here. They were here earlier today. John's a parent of a young child, and I'm sure this is bedtime for him, so he's devoting his time to us tonight. So take it away, John. Thank you so much.
Great. Yeah, thank you so much for the introduction, Shelley. And thank you, everybody, on the webinar tonight. I know that we have people dialing in from across the country and across the world, and we really appreciate your time and attention to this. And thank you to Shelley and the BSF for organizing this webinar and giving us the opportunity to reconnect with individuals that we spoke with over the summer and some people that we didn't have the opportunity to speak with over the summer. And importantly, connect with the families as well. And I know it's been some time since we had a chance to last speak, and my team has been very busy since that time, and we wanted to take this opportunity to tell you a bit about what we've been doing and the purpose of the work that we've been conducting and the importance of it, and then the next steps for the study. So when we came out to the BSF conference, which we were deeply honored to be invited and welcomed into the conference, and when we spoke with individuals at the conference, we gathered a lot of information to try and understand a bit about what the experience of having Barth syndrome is like. And the reason why we were doing that is so that we can help develop questionnaires. And those questionnaires are going to be used in upcoming trials, clinical trials, to try and demonstrate whether a new treatment is effective or not. So essentially, is it helping individuals with Barth syndrome feel better? So what we've been doing since then is analyzing those data from the conversations that we had with individuals and then developing those questionnaires. And then the next step in that process is then to test those questionnaires and make sure we got it right. Did we accurately capture the concepts that were important to people with Barth syndrome, and are we evaluating them in ways so that it can be easily read and that responses can be easily chosen? So that's the purpose of this webinar today, and I'll be talking through the findings that we found from the initial interviews, talking a bit about the questionnaires themselves that we've developed, and then the next steps. And two, I want this to be interactive, and as Shelley had said, if anybody has any questions, please chat ER. She and I are in the same room, so I'll be able to answer questions in real time. If there's anything that needs clarity, I'm more than happy to answer it in a moment. Okay. So just reviewing a bit about the goals and objectives of this webinar. So we want to review the findings from the interviews that we conducted at the conference. Those interviews, from a terminology perspective, are called concept elicitation interviews. They're essentially, what are the concepts that are important and relevant to a given condition? In this case, individuals with Barth syndrome. And we had the opportunity to talk with a number of individuals and their caregivers, depending on the age range. And what we talked about and the data that we collected was around the frequency of how concepts were reported across each age group. And we did certain qualitative exercises to get a better understanding of how much these signs or symptoms of Barth syndrome bothered individuals and how worrisome they were and how impactful they were on people's lives and the severity of those concepts. We also did qualitative exercises to understand the importance of improving those signs and symptoms with an effective treatment. So if there was an effective treatment available, what are the types of signs and symptoms that people would most want to see improved? And that just gives us better richness of data when we think about the types of questions that we're going to ask in our questionnaire that's going to be used in trials. And so following that, we developed these questionnaires, and we want to talk a bit about those and then talk about this next study that we're conducting, an interview study where we essentially want to test those questionnaires with individuals with Barth syndrome. So this is the overall goal of the webinar. So our agenda, so we'll run through a bit about the background of the study and the purpose of the research and why it's so important. And then I'll talk a bit about the study process that we followed for the initial stage of interviews. We'll talk about a bit about the folks that did have the opportunity to participate and that we were lucky enough to talk to at the BSF conference held in Clearwater. I can go a little bit into the qualitative analysis that we conducted, and most importantly, we'll talk about the concepts that came from new individuals with Barth syndrome. And then we could talk a bit about the process and the purpose of the next stage of interviews, which are called cognitive debriefing interviews. Okay. So a bit about the study background, and I wanted to open up with this slide because I think it's an important one. So my team and I had the absolute privilege to be welcomed into the conference, and not only the conference, but I feel like we were really welcomed into the community. And there's a lot of real power in the community and a sense of fraternity and brotherhood amongst the boys that are affected and the young men that are affected with Barth syndrome and their families. And I say it honestly, it was really a privilege and an honor to have that opportunity, and my team does not take that lightly. And what I wanted to present here were some of the thoughts and reports that we heard directly from the folks that we talked with during interviews about the community itself, because the community is incredibly important. And some of the things that were said were, like the top quote is, "A good day with Barth syndrome is coming to the conference and being with all of my friends." And when asked how that makes him feel, it makes him feel happy and excited to be with other people that have their condition. So I just wanted to highlight this because it's incredibly rare and it's incredibly powerful and meaningful, and it's something that we were really honored and privileged to be a part of. So I just wanted to highlight that at the outset. Okay. So a bit about the study background. So Stealth BioTherapeutics is committed to improving patients' lives, specifically with Barth syndrome. And currently they're developing a treatment that is going to be used in clinical trials and evaluated in clinical trials. They're going to hold a webinar at the end of February or early March. It's still being scheduled, along with Hillary Vernon, Dr. Hillary Vernon. And they're going to explain more about that clinical trial and the treatment itself. So any questions specific to trial or treatment, please feel free to ask during that webinar. So the purpose of this webinar is to talk specifically about the questionnaires that are going to be created and going to be implemented in that trial. And so these questionnaires in regulatory speak and scientific speak, what they're called is patient-reported outcomes. And a patient-reported outcome is any bit of information that comes directly from a patient about how they feel or function. So these questionnaires are incredibly important, and from a regulatory standpoint and a scientific standpoint, they have to be developed in ways that are methodologically sound and rigorous. And you'll hear me talk about the level of methodological rigor that we undertook for this particular questionnaire development study. So one of the from a regulatory standpoint, they put a real premium on understanding a patient experience directly from the individual that's affected with the condition. And that's why we went to Florida and had the opportunity to speak with everybody, because individuals with the condition are the best people to talk about what their experience is like. Only they know what their experience is like. So it only makes logical sense that they would be the ones who inform a questionnaire that's going to discuss their experience and whether they're improving or not. So these questionnaires that we're creating are going to be put into trial, and if the treatment is indeed efficacious, if it does work and improve signs and symptoms of Barth syndrome, the questionnaire should be able to show that, and then that gives regulators the confidence to say, yes, indeed, this new treatment does what it is intended to do. So that's the importance of the work that we're doing, and why questionnaire development is so important. So based on the interviews that we conducted, we've aggregated all of the data done qualitative analysis, and we've selected what are called measurement concepts. So essentially the signs and symptoms that are most relevant to Barth syndrome for inclusion in the questionnaires themselves. Now, as a next step, what we're going to do is conduct qualitative interviews with individuals with Barth syndrome, and we're hoping that folks on this webinar in particular have an interest in participating in this study. And what we aim to do for that is make sure, did we get this right? So did we hear you correctly? Are these the important and relevant signs and symptoms of Barth syndrome? And are we evaluating them? Did we write the questions in ways that are easily interpreted as we had hoped? And can you choose responses that accurately reflect how you feel? So this is a regulatory requirement and also a scientific requirement just in normal questionnaire development to develop a content valid tool. So that's what we're hoping to do as a next step in these questionnaire development. Okay. And so this just gives kind of a graphical overview of the steps that we've conducted so far and what we're hoping to do as a next phase. This first step in this iterative process was to conduct qualitative interviews, which we did at the conference. And then based on that, myself and my team and the Stealth team have created these questionnaires, and now we want to test these questionnaires in qualitative interviews. Okay. And on a very basic level, what it comes down to is first we need to decide what we need to measure, and then we need to decide how we need to measure it. So what are the concepts that are most important to individuals with Barth syndrome? And then how do we measure those things? So we have to select the concepts that we include in a questionnaire and actually construct the questionnaire itself. So the instructions, the actual items themselves or the questions themselves, and then the response scales. And making sure that those response scales are sensitive enough to detect change if a change does happen. So getting into some of the key findings from the interviews that we conducted, as people with Barth syndrome, I'm sure are very well aware, and their families are very well aware, there are numerous signs and symptoms that are associated with the condition. It affects individuals in a variety of different ways, but we were able to detect common themes across individuals, and the most salient concepts from our interpretation of the data did rise to the top, the most important and relevant concepts. And across both young adults and then adolescents as well, the most frequently reported concepts that we heard from individuals were fatigue and tiredness, cardiomyopathy, and muscle weakness. And there were some differences between the younger boys that have Barth syndrome and the young adults and adult individuals with Barth syndrome. And the ones that we noted were, for adolescents, this concept of eating less or having less of an appetite and physical developmental delay were frequently reported amongst adolescents specifically, and neutropenia and frequent infection were more commonly or more frequently reported by adults. Fatigue and tiredness was the most commonly reported bothersome symptom across adults and adolescents. Amongst all of the concepts that came out, fatigue and tiredness was one of the most important that we heard from individuals with Barth syndrome. Muscle weakness and fatigue and tiredness were the symptoms that were most frequently ranked as important to improve with effective treatment. These are just an overview of the findings themselves, and we'll delve much more deeply into these in just a moment. Okay, so this is, from a scientific perspective, this is what's called a conceptual model. For us, this is basically just a way to group and organize like signs and symptoms or like concepts. So the way that, from the information that we gathered from individuals with Barth syndrome, these were the organizational buckets, you can call them, that we started to parse out our concept that we found. So the big domains or buckets that we found were signs or symptoms that were gastrointestinal in nature. So there were a number of concepts around eating. So eating difficulty, eating selectivity, eating in smaller quantities. There were concepts that centered around sensory, so light sensitivity, smell sensitivity, tactile sensitivity. Cognitive symptoms and signs came up, so difficulty with attention, memory problems, difficulty with mental processing. There were neurologic concepts that came up. Cardiovascular was an important domain that arose, so arrhythmia, blood pressure issues. Pain concepts came up, so muscle pain, headache. Immune system issues, so I'm sure folks are aware neutropenia is a big concern. Frequent infection or longer duration for recovery were important concepts that came up. And the domain that had the most concepts that we heard from individuals with Barth syndrome was the physical domain, so a physical manifestation of the condition. So fatigue and tiredness, muscle weakness, low muscle tone, shortness of breath. This was a very important domain from what we heard with individuals. In addition, when we talked to individuals with Barth syndrome, there were a number of impacts on daily life that were reported as well, and we can get into more detail. Okay, so a bit about the study process, because I understand when we attended the conference, we essentially people saw us come, and there was a bit of scheduling that was done, and then we conducted interviews, and we haven't had a chance to connect and touch base. So what I wanted to do is talk a little bit about the preparation that went into the study that we conducted prior to us arriving in Florida, and then what we've been working on since that time. So prior to the conference itself, we had to develop all of our study documentation. So what that means is we create a study protocol or study manual, essentially outlines the methods of the study. We created our interview guide, informed consent forms, study screener, demographic and health form, and all of those documents were submitted to what's called an independent review board. That's essentially a separate ethical review, and it ensures that the study that you conduct meets all ethical standards for good research practices. And that's something that's really important and something that we take very seriously as an organization. Then, with the very great help and drive of the BSF, they've helped to identify individuals that were interested in participating in our interview study, and they did a wonderful job helping to schedule the interviews, which I know was a large undertaking, and we very much appreciate. And while we were there at the conference, we conducted 33 interviews with individuals with Barth syndrome and/or their caregivers. And we could talk a bit about how those interviews went and the split between caregivers and age groups. So since that conference, we've had all of the audio recordings from those interviews transcribed and anonymized. So individuals' names, the names of cities, the names of doctors, all that information was redacted, so there's no identifying information in those transcripts. And once we had those transcripts, we did qualitative data coding and analysis. And essentially what that means is we looked at the transcripts and we identified any time that a sign, symptom, or an impact concept was mentioned or reported by the interviewee. And then as part of the analysis process, we tried to understand things about those concepts. So if somebody mentioned fatigue or tiredness, so how severe is that concept? How long does the fatigue last for? When does it occur? Is it during activity? Is it following activity? And trying to understand more about the concept itself so we can understand how to measure it in a clinical trial and develop questions that can accurately capture that concept. So following the qualitative data coding and analysis, we then selected measurement concepts. So the signs and symptoms that were going to be included in the questionnaires that we're creating, and then we created the questionnaires themselves, which brings us to our current state right now. So recruitment. So as I mentioned, we were honored and lucky enough to attend the conference that was held this summer, and really appreciate everybody's time who had the chance to participate, and thank you for your time. And so we spoke with 33 individuals, and the interviews themselves were conducted over 60 minutes each, and they were all conducted face-to-face with members of our Adelphi Values staff. And the interview process, so I could talk a little bit about how the interviews progressed individually and how we capture the information that we were hoping to capture. So there is a methodological precedent to, when conducting concept elicitation interviews, so this type of interview that we conducted, to do so in a way that we understand a condition in a subject's own words. So essentially, we don't want to introduce bias into interviews, and we want to hear spontaneously what people have to say about their condition. And one of the ways that we do that, and if folks that participate in interviews remember, oftentimes the interviews started out with very simple questions. Okay, so what is it like to have Barth syndrome? What is your daily life like? What's a good day like with Barth syndrome? And what is a bad day like? And then interviews transpired from there based on what participants told us. Once we gathered all of this information spontaneously, we did a number of qualitative exercises during the interviews themselves. So one of them was to ask interview participants, what are the most bothersome signs and symptoms of Barth syndrome? And this just tells us a little bit more about the condition itself. Once we understood from each individual what the most bothersome symptoms were, we did a qualitative exercise whereby we asked each person to rate the bothersomeness, the worry, the impactfulness, and the severity of each of those signs or symptoms. And again, this just provides additional evidence that can help us make decisions about concepts that are important and relevant to potentially include in a questionnaire. Another qualitative exercise that we did was a ranking exercise of the top 5 signs or symptoms to improve with an effective treatment. Again, this just provides additional supportive evidence for concept selection for a questionnaire itself. And then importantly, we talked about the impacts of Barth syndrome on individuals' daily lives. And this is really important when we consider treatment. We want to ensure that we are thoughtful and considerate about the holistic impact of Barth syndrome. So for this questionnaire development study specifically, we're targeting signs and symptoms, but from a clinical trial perspective, we want to ensure that we are accurately capturing the whole patient picture. So if your signs and symptoms of the disease improve, but your quality of life does not improve, or your quality of life gets worse, that's something we really want to know. So this is really important to understand, and we appreciate all the feedback that we've collected from individuals. Okay. So for qualitative analysis, each interview was audio recorded and transcribed. Information from each transcript was coded and organized for signs, symptoms, and impacts of the condition. And all of those transcripts were then aggregated so that we can see individuals in the totality of the full sample. And that provided the information that we needed to help select concepts for inclusion in the questionnaire. Okay. So as I mentioned, we were lucky enough to attend the conference that was held. And so that was our interview setting for the concept elicitation interviews. And so the folks that we talked to, the way that we are approaching this study, and there's a number of considerations for why we're approaching the study the way we are. So the way that we're doing these questionnaires is to have 2 separate age groups. One of them is going to be targeted for an adult population, and the other is going to be targeted for an adolescent population. And there's a regulatory precedent, so an FDA precedent for why you would want to do that. 2, the condition may present itself differently in a younger population than an older population, and when we look through the data, we can see some of the differences in how Barth syndrome presented. And also there's considerations around item wording for an older population versus a younger population. So what we wanted to do was to talk to adolescents and to adults and see if there were similarities and differences, and then that helped inform the actual questionnaire construction itself. So for the adolescents, we spoke to folks that were 15 years of age or younger and or their caregivers, and we talked to 18 individuals for that. The age range for the adolescents that participated in the study was as young as 2.5 years of age and as old as 15. And for the adult population, we talked to 15 individuals, and to be eligible for the adult population, you needed to be 16 years of age or older. So for the individuals that we talked to at the conference, the ages ranged from 16 years of age to 34 years of age. So the interviews were conducted in a number of ways. So we either spoke to individuals with Barth syndrome on their own. We spoke to caregivers on their own, depending on the age of the child. Or we did what were called joint interviews, where we talked to both individuals and their caregivers. So for the adolescent age group, we spoke to 7 individuals independently. We spoke to 9 caregivers independently, which made up half the sample. And we had 2 interviews that were conducted jointly with both individuals and with caregivers. For the adult population, 14 of the interviews were conducted independently, and 1 was conducted with both the individual and their caregiver. Okay. So now we're going to first talk about the study findings that came out of the adolescent age group. So for the adolescents, 48 symptom-based concepts were reported across all study participants. And this is a comprehensive list of all of those concepts. And they include the frequency with which they were mentioned and the percentage of the overall age-based population that reported the concept. And you'll see that some of the concepts are called out in bold color. So the frequently reported concepts, we considered frequently reported if it was mentioned by 60% of individuals or higher. Those are called out in blue. So those are inclusive of cardiomyopathy, fatigue and tiredness, and muscle weakness. Concepts that we considered to be somewhat frequently reported were mentioned by between 30 and 59% of the age-based population. Those included eating less, so having smaller appetite, difficulty eating, so this idea of chewing and swallowing, and eating selectivity, having strong preferences in what is eaten, what individuals wanted to eat, and strong aversions for certain tastes. Neutropenia was also somewhat frequently reported, and physical developmental delay. And as you'll notice, these headings, so the dark bold headings, so physical signs and symptoms, cardiovascular signs and symptoms, these all align to the previous conceptual model that you saw. And that's why that conceptual model is important. It just helps us as scientists to conceptualize and organize concepts in a way that makes sense. So this is a comprehensive list of all of the concepts that individuals mentioned during interviews. Okay. So this is a graphic depiction of the frequently and somewhat frequently reported concepts for adolescents. So fatigue and tiredness was mentioned by 17 of 18 individuals. Muscle weakness was mentioned by 15, cardiomyopathy by 14. So those are all frequently reported and important concepts that emerged from the adolescent population. Also important was eating less, physical developmental delay, eating selectivity, eating difficulty, and neutropenia. So one of the exercises that we did, and I mentioned earlier, this qualitative exercise of trying to understand a bit more about the level of bother of certain concepts, how much certain concepts worry individuals, the impact of certain concepts on people's daily lives, and how severe these concepts were to people. So what we did was, for concepts, we asked individuals to rate them on a scale from 0 to 10, 0 being, for example, not bothersome to them at all, and 10 being the most bothersome or extremely bothersome. So these numbers, if you look at muscle cramping in terms of bother, this was rated as extremely bothersome to people. It was rated as an 8 out of 10, which gives us a bit more information about that concept in particular. So muscle cramping is something that bothers people with Barth syndrome. Fatigue tiredness was mentioned by 7.4, or was rated as a 7.4 out of 10. So this is a concept that is bothersome to adolescents with Barth syndrome. Headache was mentioned as being worrisome and impactful on people's lives and severe when they do occur. So that gives us a bit more understanding of that as a concept and how it impacts individuals with Barth syndrome's lives. So fatigue and tiredness and muscle weakness, muscle pain, these are all concepts that were bothersome, worrisome, impactful, and severe to adolescents. Okay. So another qualitative exercise that we did was to ask what signs or symptoms would be important to improve with an effective treatment. And this was done as a ranking exercise. So we asked individuals to rank 1, 2, 3, 4, and 5 across all of the concepts that they experience. So the concept that was most frequently ranked as number 1 to improve with effective treatment was fatigue and tiredness. And that was mentioned by 1/3 of adolescents. So that just gives a little bit more importance to that concept and provides a little bit more supportive evidence for its potential inclusion as a question in a questionnaire. Muscle weakness was the symptom that was most frequently ranked to be improved with an effective treatment, and that was followed by fatigue and tiredness. So 56% of the population ranked muscle weakness as important to improve, and 44% ranked it at fatigue and tiredness as important. Okay. And so that was a review of the adolescent sign and symptom data. And now we're going to talk a bit about the findings that the data that we collected and the findings from the adult age group. So adults reported experiencing 40 unique sign and symptom concepts relevant to their experience with Barth syndrome. And similarly with the color coding, the frequently reported concepts, so reported by 60% or higher of the population, those included cardiomyopathy, neutropenia, infection, fatigue, tiredness, and muscle weakness. So notably, fatigue and tiredness was mentioned by every single individual that we talked to. And this was mentioned spontaneously by every individual that we talked to. The concepts that were somewhat frequently reported included arrhythmia, so that was a quick heart rate or a heart rate that was offbeat, muscle pain, shortness of breath, experience with mouth sores, and dizziness and lightheadedness. And similar to the adolescent presentation, this essentially goes through all of the concepts that came up, including all of the frequency of reports and the percentage of the population that reported it. Okay. So again, this is a graphic depiction of the frequently and somewhat frequently reported concepts. So as we mentioned, fatigue, tiredness was mentioned by everybody. Cardiomyopathy, neutropenia, and muscle weakness, all very frequently reported concepts. Infection, so being prone to infection and longer time for recovery was somewhat frequently mentioned. Arrhythmia, muscle pain, shortness of breath, mouth sores, and dizziness and lightheadedness. Okay. And so similar with the adolescents, we did the same rating exercise for bother, worry, impact, and severity. And this one's grouped a little bit differently, and there's a reason for that. So muscle pain and fatigue and tiredness were the two concepts that were most frequently rated as bothersome, worrisome, impactful, and severe. And this really tells us something about these two concepts as being incredibly important to the adults that are affected by Barth syndrome. You'll see that neutropenia was also rated very highly for severity. It was not rated highly for bother, worry, or impact, and that's why you don't see any numbers or any data included there. The ratings for those were all a 2. So for bother, worry, impact, and severity on a scale from 0 to 10. But this tells us something very important about muscle pain and fatigue and tiredness, and helps provide additional supportive evidence to include these concepts as questions in the questionnaire that we're developing. Okay. So the concepts that were reported as being important to improve with an effective treatment. So fatigue and tiredness was most frequently rated or ranked as the most important to improve, which was 2/3 of individuals that we talked to, and that was followed by muscle weakness, which was the other third of individuals that we talked to. Similarly, fatigue and tiredness was also the most frequently ranked as important to improve across all 5 rankings, and that 13 individuals reported that that would be very important to improve with effective treatment. And that was followed by muscle weakness, which was mentioned by 60% of individuals we talked to as important to improve with an effective treatment. So again, this tells us something very important about the concepts of fatigue and tiredness and muscle weakness. These are symptoms that are very bothersome and very important for individuals to see an improvement on if a treatment were indeed available and were efficacious. Okay, so that was a review of the sign and symptom concepts that individuals mentioned when we talked with them during interviews. And now we're going to talk a bit about how Barth syndrome impacts daily lives. So individuals were asked to talk about how indeed Barth syndrome impacts their lives. And similar to how we organized concepts for sign and symptoms, we tried to create categories to organize the types of concepts that came up as far as quality of life impacts of the condition. And the way that we did that was as follows. So there were a number of physical functioning impacts, so things like ability to walk or participate in activities that were physical in nature. And 97% of individuals that we talked to mentioned some kind of a physical impact of Barth syndrome. We heard a lot about impact on school and work, so that was mentioned by 70% of individuals we talked to. There was a lot of discussion around social functioning, so relationships, participating in social activities. Emotional well-being was mentioned by a lot of individuals that we talked to, and also this notion of self-perception. And self-perception is, at least the way that we are considering it, is how someone views themselves and how they think about themselves. And we heard from individuals that Barth syndrome does impact the way that they think about themselves, and that was important. So a review of the impacts as how adults that we spoke to discussed them. So for physical functioning, the types of things that people discussed were difficulty being generally active. And if you think about the types of signs and symptoms that people were talking about, these notions of extreme tiredness, fatigue, muscle fatigue, weakness, and pain, this makes sense that it would have a physical impact on individuals' lives. People mentioned not having enough energy to walk at what they considered a regular pace, and an inability to run. So these are the types of physical impacts that individuals discussed when we spoke with them. For social functioning, or what we called relationships/social, there was a difficulty in being socially active that was reported. So going out with friends, in the adult population, dating was seen as being challenging, and that's those were reported as being important call out. Disease management was seen as also an impact of the condition. So essentially keeping up with treatment regimen for symptom management was seen as a challenge and something that impacted individuals' lives. The types of emotional concepts that came up, one thing that was very commonly mentioned from individuals is feelings of depression. And we really appreciate individuals' honesty and their willingness to talk about this with us, because we do, from speaking with a number of individuals, we do understand that this is a common experience for Barth syndrome and for individuals with Barth syndrome. And it's important, and it's one to be mindful of, and we appreciate people sharing their thoughts and experiences on that with us. In addition, the people that we talked to mentioned feelings of being either lost or confused due to lack of information for Barth syndrome. So that was an important finding from our study as well. Impact on school and work was an important one as well. So if you think again about these physical impacts of the condition, so being tired and fatigued and in pain and feeling weak, that hinders people's ability to work or to go to school. So that was something that was commonly mentioned as well. Okay. And so a review of the impacts for adolescents. In many ways that they were similar, but some of the activities were a bit different based on the age group. So from a physical functioning standpoint, there was this inability to play or excel at sports or to do things like participate in recess or generally be able to play with their friends or their siblings and things like that. So inability to participate in physical hobbies. There's a number of hobbies that were impacted. Hiking, horseback riding. We have somebody with a trampoline, which is great. Karate. So being able to even participate in those types of things. And also this inability to keep up with the friends of their siblings' walking pace. So again, these physical impacts of the condition are really important to individuals. From a recreational standpoint, we saw that people either had an inability to perform activities for long periods of time, and things like drawing were mentioned, or an inability to participate in activities at all, just because they're either too tired or they don't have the energy to do so. The types of social impacts that were reported were difficulty visiting with family and friends, difficulty playing with friends, and those kinds of things. Disease management was also mentioned. There was dissatisfaction with having to administer injections, which one could anticipate being problematic with a condition. And for school and work impacts, the vast majority of these, based on the age group, were school-related. So difficulty completing schoolwork, generally due to fatigue and tiredness. You just can't get through assignments, things like that. And then also difficulty carrying heavy objects. So a few folks mentioned having to carry a defibrillator in school, or just carrying around their backpack, or being able to walk to their classes or to play at recess, those kinds of things. So carrying objects or general mobility is impactful at school as well. Okay, so if anyone has any questions at this point, that would be a good time. Otherwise, I can talk a bit about the next phase of work that we're hoping to conduct, which is going to be qualitative interviews. Okay. So what we've done since the conference and since having the opportunity to speak with with a number of you individuals, we've developed 2 questionnaires that are going to be further evaluated. And so these questionnaires were developed for specific target age ranges. So one is intended for use with individuals that are 16 years of age or older, and the other is targeted for ages 12 to 15 years of age. So as I mentioned at the outset of the call, there is a regulatory requirement, so an FDA requirement, that when you develop questionnaires, you have to, and not just from a regulatory standpoint, but from a scientific standpoint and a survey development methodology, there is a requirement and a premium to test the newly created questionnaires with individuals to make sure that it can be easily read, understood, that the questions can be completed in a way and interpreted in a way that we had intended, and that response choices are fit, and that people can select response choices that accurately capture how they feel. So what this includes is qualitative interviews, and essentially what we want to do is go through the questionnaires themselves, go through the instructions, go through the questions themselves and the response options, and just make sure that, did we get this right? So we talked with all of these individuals and their caregivers about the condition. Did we get it right? And are we capturing this accurately? So this goes through the goals, objectives, work activities, and the hopeful outcome from this phase of work. So the goal is to evaluate individuals' understanding and ability to complete the questionnaire that we created. And to do that, we're going to conduct qualitative interviews. And these are called cognitive debriefing interviews. That's the scientific terminology for it. So the work activities, what we've done to date, we've developed a study manual and the accompanying documents, or we're currently finalizing those documents now. Similar to the previous interview study, we are going to submit all of these study documents for ethical review with an IRB. So essentially, they review all of our documents and ensure that we're conducting the study in ways that are ethically defensible. Then what we want to do is enroll individuals that are interested in participating in the qualitative interview study. We will conduct the interviews themselves. We will do a qualitative data coding and analysis process that's not wholly dissimilar to the previous analysis that we did, but it just has a different methodology and different intended outcome. And then at that point, we need to make determinations on are there any changes that we need to make to the questionnaires themselves. And then you'll see this content evaluation reports. So part of what we've been working on since we last spoke is documentation. So when you're creating these questionnaires that are going to be used in clinical trials, there is an expectation for a lot of documentation that all gets submitted to regulators to support the actual questionnaire that you're creating. So each activity that we complete has its own study report that is intended to be submitted to FDA. So that's part of the process as well, is to making sure that we are thoroughly documenting all of our methodologies and all of our findings. So the hopeful outcome of this is that we can support what's called the content validity of the questionnaire. Are they measuring the things that are important and relevant to the condition, in this case Barth syndrome, and are they doing so, are we doing it in ways that individuals can easily interpret and complete? Okay. So here is, this goes into a little bit more detail of the study process of this next phase of work that we're doing. So as I mentioned, we're currently developing the study documents now, and then we want to enroll individuals into the study that are interested in participating, and then we hope to conduct 24 qualitative interviews with individuals with Barth syndrome. Then, based on those, recordings of the interviews will be made, and interviews will be transcribed and de-identified, similar to the previous phase of work. And we will do qualitative data coding and analysis of those transcripts. And at that time, we'll make determinations if questionnaires need to be revised at that time. And then comes in that documentation piece that I was just talking about, creating study reports that are going to be submitted to FDA. Okay. So we hope to conduct 24 interviews with individuals with Barth syndrome. 12, we're targeting 12 interviews with adults. So for the purposes of this study, we're considering individuals 16 years of age or older as adults. and 12 interviews with adolescents, which we are considering 12 to 15 years of age. The hope is that we conduct 12 interviews in each age group. I realize that that might be difficult, and we're hoping that people are excited and interested in participating in this research because it is really important to help have new treatments become available. There may be situations where we cannot get to 12 individuals, though we really do hope we can. And at that point, we have to make certain decisions about the study design itself. And that'll depend a lot about the data that we're collecting. So it could be instances where we conduct interviews and individuals are reporting that the questionnaires are comprehensive to their experience with Barth syndrome and easily understood, and they have no issues with them. And at that point, we need to make a determination of whether we feel confident and comfortable to proceed with having only conducted 10. There could be instances where we might have to get a bit creative. So this study is intended to be conducted solely in the US, and it's not in any means a way to exclude anybody, because we hope and wish that we could talk to everybody with Barth syndrome to better understand the experience. The reason why it has to be a US-based study is because our ethical approval is only upheld within the United States. So we went through a similar process with the ethical approval for the first phase of research. The only difference was that we conducted that entire study in the state of Florida, which is within the United States, and all data was collected in the US, regardless of what country of origin the participant was from. So now that we don't have a conference to attend to, we'll be conducting most of these interviews virtually, so over the telephone or via WebEx. So from an IRB and an ethical standpoint, it depends on where individuals are based geographically as far as where you have IRB coverage. So for this study in particular, we're focusing on the US specifically. However, if we're having difficulty hitting recruiting targets, one potential option is to look into other countries potentially and try and submit to their ethical review boards. That is a fairly complex process, and it's fairly time-consuming as well. So that's essentially a backup option. But we are hoping to hit our target of 12 for each age group. So as I mentioned before, results from these interviews may inform potential changes to the questionnaires themselves. So a bit about recruitment for the cognitive debriefing interviews, so this next phase of research that we're doing. So all of our study documents to enroll individuals will be online. So what we need to do is we have to create an online platform for these and gain IRB approval before we can start enrolling subjects. I realize that individuals might be interested in learning more about the study, and we would welcome you reaching out to us for that. And after this webinar, I can provide contact details for that, or Shelley, whoever makes the most sense. And we can talk a bit more about the study itself. But essentially what will happen is individuals will receive a link, a web link, and it will provide the informed consent form online. And we invite people to read through the informed consent form, and if they have any questions, they can reach out to us directly. If they complete the informed consent form online, it will then come to a screener. And the screener essentially confirms eligibility for the study. At that time, we will receive a notification that this has been completed, and we will reach out to schedule an interview. And as I mentioned before, due to the geographics, these interviews will most likely be conducted virtually. Adelphi Values office is based in downtown Boston. If there is anybody that is close to Boston and wants to conduct these in person, we'll be more than happy to host our office. So I realize not everybody lives in Boston. So for individuals that are between 12 and 17 years of age, there is a legal requirement that your parent or guardian also signs an informed consent form. It's based on U.S. Law and regulation that anyone under 18 has to have a parent or guardian sign for them. And that was similar to the first phase of research as Okay. So the conduct of the interviews themselves. So the interviews are anticipated to last for approximately 90 minutes. And as I mentioned, the vast majority, and likely all, will be conducted virtually. So either via telephone or web-based stream, whatever folks are most comfortable with. The interviews will be audio recorded, transcribed, and anonymized. And again, we really just want to focus on how people are interpreting the questions, the response options, and the instructions from the questionnaires themselves, and any feedback that people have on the questionnaires. And then the study data will then be qualitatively coded and analyzed. For participation in the study, individuals will be compensated $150. And then if anyone is able or interested to attend our office in Boston, an additional $50 will be provided to cover travel expenses. Okay, and just a quick time check. I know we only have a couple minutes left, and luckily that was the last slide. Okay, does anybody have any questions? I know that that's a lot of information.
If anyone has any questions, you can raise your hand. I know some people have had a challenge getting their questions or posting their questions, but if you have any questions, just either send them to ER or you can raise your hands and let us know. Okay, it doesn't look like we have any questions right now. I just want to thank John and ER for their time this evening and for giving yet another wonderful webinar for all of us. They incorporated some of the questions that we received earlier today in this webinar, but this is a lot of information, as John mentioned, and I know that it's a lot to digest. We heard this a couple of weeks ago, and I found myself going back through the presentation and had additional questions for him. So John and ER, as John said, they are welcome any questions that you may have later. They want you to be as informed as possible about it, and we intend to keep you posted on the progress of this report or this study as we move forward. And I would like to thank everybody for joining us tonight. And again, John and ER, thank you so very much for doing this for us. This has been very informative. We appreciate it. And
Yeah, thank you. Oh, sorry. Thank you so much, Shelley, and thank you to all the participants. And honestly, this has just been such a powerful experience for myself and my team. And we just can't thank you enough for being so welcoming and for taking the time for this study. So thank you very, very much.
okay, we have a lot of thank yous at the bottom that from the participants who have said thank you. And I know that we had, even though it looks like we had 16 people on the call this evening, we actually had quite a few, about 9 more who joined us by phone. So I'm just going to double check my email to make sure that I didn't receive any additional questions from those who were calling in, and it looks like we don't. But we had a record-breaking webinar tonight with 26 participants. So thank you all for joining us. And again, if you have any additional questions, this is a group that is welcoming any questions that you may have, and we look forward to moving this disease out of here and stopping the suffering and that is caused by Barth syndrome. So good night, everybody, and thank you.
Thank you very much. Good night.